Thanks for joining us for another Fit Nation Lunch and Learn. Today you got Kaylin and Derek hosting you guys and taking you go through this again. Today we have an awesome guest speaker joining us today, Bryan O Rourke, and we covered a lot of awesome information there, huh?
Definitely a lot to go through. I mean, listen to the entire podcast and webinar to get all the details. But one thing that jumped out at me is some pretty optimistic news coming from Bryan, looking at potentially a summertime of next year getting back to normal, so to speak. I know that's one of the things that jumped out for me, Kaylin. How about with you?
Yeah, so it was overall great because we talked about a variety of different things. So when we go through this, you're going to see that we talked about, what were some of the past situations that have happened that affected the industry similar to COVID. Bryan, I'm not going to ruin it for the people who are joining us and kind of say the example that he was referencing, but I'll definitely say it was a curveball and I wasn't expecting it at all. So we talked about, the past situation that happened that impacted the economy in a way that was just unprecedented, which was interesting. We also then talked about the vaccine itself, which for me was that was probably the biggest thing that I took away from it because I didn't know so much about what the vaccine what the new vaccine means, particularly the new technology. So it, I didn't know what mRNA was, and so that was a great piece for me to learn about how that is vastly different from the way that we had vaccines in the past.
Yeah, and I think on the back of that, obviously that's taken into consideration when Bryan's going to be talking to us about the timeline back to normal. So without spoiler alert, without spoiling anything ahead of time, if you're able to take the chance to get the way through the webinar and podcast, you're also going to learn from Bryan what he sees as a very opportune segment for businesses to kind of take advantage of in the very near future.
Yeah, awesome. What do you say we jump into it?
All right, sounds like a plan. Let's do this.
Good to see you, Kaylin. Nice to catch up again. It's been a few months, I think, since we last spoke, and always a pleasure, Derek. Nice to meet you today. It's a pleasure.
Yeah, and a lot has changed in that time, definitely. So yeah, with that kind of being said, we have an awesome set of questions that we're going to be jumping into today that is going to shed some light on what we can potentially expect as we talk about having a vaccine, our path to normality, the role of technology within that. So, with that kind of being said, would love to be able to start first by having you talk a little bit about your background. So. Yeah, we have a wide range of different people who are here, many of which I'm sure know about you and have followed you and know your background. But for those who haven't, yeah, can you shed a bit of light on your path into fitness and your role within fitness as well?
Yeah, sure. And I've seen some of your previous guests, all very fine people who I know, and so it's a great honor again to be here. I have a background in finance and work in a number of different industries. Got involved in fitness in the mid '90s. And since that time, we've done a lot of things. I've owned clubs. I'm involved in a chain of clubs in Thailand, and then have 14 different operating companies in the space, both in Europe, the Americas, and Asia. And I have the privilege of sitting on the board of directors of IRSA, which is the International Trade Association. For the organization, for the industry, I've written 7 books with co-authors and have spoken on 4 continents on trends in the space for the last decade, about probably 80 to 100 different times. I have a podcast that's pretty widely followed, Fitness Plus Technology, and serve as the CEO of the Fitness Industry Technology Council, and have many friends. My wife's Dutch, so know Hugo and his brother, and have been to a number of your events, and so I have a great affinity for our Virtua Gym friends. So it's a pleasure to be here, and welcome to everybody.
Excellent, Bryan. So it sounds like you have no free time, basically, is what I'm getting at from the laundry list of things you're doing.
Well, they say that busy is the new stupid, so I try not to be the guy that doesn't have time. I have time for you all, so I enjoy visiting and talking about things with folks like you and the audience here. So thank you again.
Excellent. So to start off, obviously, we're going to get into the current situation with COVID and the world in general. But curious to know, while we're talking about your previous experience, have you ever seen an event or situation kind of impact the world and the fitness industry and in kind of a similar way? And anything we can learn from any of those previous events that may have happened?
So, change is something that, time gives you perspective about, right? So when you look at an event like pandemics, certainly there have been pandemics throughout the course of history. Unfortunately, there's also been comet strikes, on the Earth, extinction events. So when you think about the modern day, and the reason I say that is when you think about the modern day health club industry, and when I say modern day, you're really only talking about probably a 40-year horizon, 40, 50-year horizon, even though it dates back further in physical culture. But one trend that's very different, but to illustrate the point of thinking about the impact of things, because obviously pandemics are, very, very rare. Hopefully the last time we had one was a century ago. But one I like to talk about as being the most significant impact to the present day gym and health club industry is the birth control pill, which is, and when you think about that, it's very kind of curious. You all are going to think for a minute. When you think about that, you look at a pandemic, thank God we have scientists and we're getting technology to help us eradicate this, knock on wood, hopefully in next year. But the point being that there are always things that happen we don't understand their implications. Some punch us right in the face like this one. Others sneak up on us and they have an even more profound impact than the other ones that we might think had a more profound impact in the moment because we're in the moment. So the reason I bring up birth control is that happened in the 60s where it became more widely distributed. And what it led to is it led to women entering the workforce at a much higher rate. Back then, women didn't go to school as much because they were they had to kind of think about being pregnant at a young age, or they chose to get married because of this sooner. And all this, what happened is the rise of the two earner household, which started to happen in Western Europe and the United States in the 70s around the sexual revolution. Women started going to school en masse. And when that started happening in the 70s, in the 80s, when in the United States, some of the major fitness change and the birth of URSA actually occurred in the early 80s. You saw that women were having fewer children. They wanted their own free time. There was a split of responsibilities between a man and woman in the household. All these things changed. Women became more equal, even though they still weren't making the pay. A lot of things changed. And so health clubs emerged as a way, because of the increase in disposable income by household, because of the emergence of childcare, because of all these things, it was really a big fuel. Women were a huge fuel to the health club industry in its early days commercially. And so some might say, well, why in the hell are you talking about birth control when we're talking about a pandemic? I think the point being that it only in time can we gain perspective. And there are going to be a lot of things about COVID-19 that aren't as impactful as we think they are today, and time will tell, and other things that were already underway that COVID just accelerated. So, and then similarly with other trends, like I just mentioned, sometimes people don't see these things kind of coming up. They don't even look at them as a trend and an impact. So, it's, to answer your question directly, Derek, no, this is an unrivaled impact in the near term, but what the long-term implications are yet to be understood.
Yeah, wow, that is definitely an interesting comparison, and I love the way that you put it as well, where you have the short-term effect. However, the long-term effect could be far greater in terms of what opportunities that could come up as a result. And when you were talking about the short-term effect, I was just taking a moment in order to think about it myself. I've joined and hosted a couple of these interviews already, and it seems that there, even with COVID happening now, not everybody truly understands the short term impact of COVID. So I'm super curious, as far as like your perspective on what has been the impact of COVID on the fitness industry at large.
Yeah, there's many major things. You've touched on some of these things in your prior sessions that you've done with other folks. Obviously, in the near term, the shift to digital, obviously, right? Being able to serve clients in and outside of facilities, mostly outside, depending on the geography you're in. That's been significant, a very large, significant impact that we're going to continue to see the effect of. But as I mentioned before, those seeds were already planted, right? The necessity is the mother of invention. And so people shifting to digital service was a big immediate thing. Another thing is, of course, significant chains and locations shutting down, which is creating orphaned members in certain marketplaces, creating merger and acquisition activity, as you've seen in Europe and in the US, more to come. You're looking at probably 25% to 30%, maybe a little less or more, of rooftop physical facilities permanently shutting down. In the near term, that's been waning. You're seeing a lot of bankruptcies and restructuring. You're seeing behavior with not just pure digital, but customer behavior, consumer member behavior, looking to work out outside in other ways that are convenient to them, given these dynamics. And the other thing you're seeing, I think, is the shift to health. The idea of immunity, the idea of people taking care of their health, being CEOs of their own health, and being more mindful, because those are mega trends that were already there. That this hopefully will bring some folks to light with the corollary between people's chronic conditions and what the impact of a disease is. So those are a few. We could write a book on the subject, but I won't take all day.
Excellent. And I'm just thinking more along that line, and forgive me for putting in a little bit of a selfish question here, but I work a lot with our corporate partners. And even if we're not talking about corporates in general, but we're also thinking about, fitness centers who obviously have quite a bit of staff on hand, studios as well, et cetera. As someone who's involved in so many different organizations, et cetera, how do you find that you're able to create motivation with the employees, especially when you hear some of these, I guess, hard-hitting areas? So how do you keep them motivated and, delivering top performance?
That's a great question. And you hear these answers, so I don't want to sound trite or a little, contrived in my answer, but because there's the practical side. In some cases you're not. Some people it's very challenging for them, and they've suffered a lot. And so me saying a few words or ideas that would make that seem less difficult than it is would be wrong. So I don't want to come across in that way. But at the same time, it has to do with the culture of the organization. And is it a place that people give a damn about what's going on? Do they really care about people? And do they think they're making a difference? And do you have a good environment to work in? Because I think, if barring all the other unfortunate dynamics at play for many, the reality is that in the end, if people feel like the organization's ownership and the structure of the business, really cares about the people they're serving and their employees and partners, and they act that way, that's a big thing. So I think, motivation, intrinsic, extrinsic motivation, I think for organizations, it's, if you give a damn and you really did before and you do now, you're going to have a strategic advantage. If you don't, well, you probably need to do a little soul searching about what you're doing in the first place. So.
Yeah, if it's all right, Bryan, I'd love to go back to what you mentioned earlier about being able to take a look at some of the take a step back, look at and analyze some of the long-term effects of what's happening in the moment. As you're kind of looking and surveying the landscape, is there anything that you see right now as maybe a problem, a common problem that you might see kind of bubbling up for us as a result of COVID? And then the flip side of that is, what kind of opportunities do you see as well?
Yeah, well, I think in obviously in the United States, it's been this way in parts of Europe as well and other regions. Is in the interim is the perception of the industry in general as being more aesthetically, oriented and not health oriented, and the public perception of the industry. That's a problem that's bubbled up. It's why we've seen a lot of governmental action, despite a lot of data that would not equate a bar to a health club or a gym for the most part. But the perception is reality, and I think we're going to need to be aware of that for the years to come and ask ourselves, well, what seeds were we planting? Obviously, our industry is full of a diverse array of delivery systems and business models. So, with many different attributes. So I don't want to be overly broad in the answer, but I think certainly one of the things that has been a problem is, and if you look at the board of URSA and our interim CEO, Brent Darden, we spent a lot of time on this, a lot of initiatives working around gaining greater public trust around the industry space, because that's really been an Achilles heel, where we've seen government intervention really harm a lot of operators who aren't even allowed to service their members. So that's really been, I think, an immediate issue that we've got to be mindful of. Now, long term, when it comes to the opportunities, obviously, the fundamental underlying drivers that have been growing the industry space for decades now have been, the awareness of health in general, people wanting to be fit, people wanting to, be healthy, a lot of demographic trends around that. That are driving that, and that's going to remain. So the market's going to continue to grow. Obviously, it's been fragmented in its delivery systems, but anytime you go through a crisis like this, where you're going to see a lot of supply removed from the marketplace, business operators and professionals who are fortunate enough to be prepared will be able to really gain a market share and build their businesses up quite a bit. So for those that are paying attention and have the financial and personal wherewithal to fight through it, I would think that in a year's time or less, perhaps, you're going to see a great surge of opportunity for those people as members are orphaned. Also, as there's huge pent-up demand, because people have not been able to go and experience the cultural normalcy that they've been used to for years. And once that is a green light, the facilities and businesses in the fitness industry that are open and operating are going to have a huge influx of customers. So that's more in the near term. And then, of course, in the long term, as I mentioned, those underlying mega trends are still there, and the industry will continue to grow.
Yeah, that's a great answer. And one of the things that you mentioned within there is how important it is for a gym owner in order to and us as people within the industry to be able to create trust within the industry. How can we maybe make that communicated at the local level? So if I'm a gym owner and I'm listening to this call today, what can I do in order to be able to create trust with my local community and have a bigger impact?
Yeah, well, I hope both your parents are alive and you have a good relationship with them. I was very lucky. My dad's passed, but my mom's still alive, and I was very fortunate. And I always ask people the question, why do you love your parents, right? Why did you love your parents? Well, I love my parents a lot. Well, because they loved you first. That seems a little, again, trite, but the reality is trust. When you look at trust, the Edelman barometer, as I've talked about quite a bit the last few years, is a measure of trust. It's done with a survey globally. And trust is at its lowest level since the index has been measured. And the reason is a lot of things. It has to do with what we see digitally on our platforms, where algorithms are tricking us into garnering our attention by being more controversial. It has to do with many different things. But the truth is that trust has become the most valuable commodity in the world today. And, when you look at things in business, whether you're a single personal trainer, and I'm sure a lot of trainers out there will hopefully understand this, or if you're a chain of clubs or mega chain of clubs, or whatever business you're in, you just can't bullshit people anymore. And if you try to con them and don't deliver on promise, you're not gonna earn their trust. And this has to do with a lot of things that extend to how your brand and how you conduct yourself. And it's hard because you have to really play long ball. You have to really think long term. When you think of the concept of marketing, for example, most people don't want to receive spam email. They don't want to be enticed. They don't, because they have incredible bullshit meters. But if if you're giving, if you're really helping from a sincere place and not expecting in return, if you're doing a lot of things for your community, if you're creating solutions or help for people, if you're giving content away in many respects, if you're helping young athletes be more successful through their sports pursuits, if you're helping an organization in your community and the people involved understand how to live more healthy, and you're doing that, and you're really doing it from a sincere place, and you help people, over the long run, you're going to build a lot of trust. And today, there's a lot of quant marketers out there. They look at things like conversion and things like that, and a lot of that is great, but when you're doing that, you're really picking the fruit off a tree that had to grow for many years and be tended to. So I think to do the right things means doing the right things, and to do the right things means giving a damn and really giving. And you got to make sure you're in the business for the right reasons, because it takes time to build that trust. But man, when you do, that's a real differentiator today. And I don't care what business you're in.
No, excellent. I think we can. We're all excited to see what's going to happen here in the near future. I don't think there's any kind of perfect segue to this, but you had mentioned about public trust. Obviously, one thing that's in the eyes of the public right now is this talk about the vaccine. So me and Kaylin have actually, we have a couple things we'd like to get your opinion on related to the vaccine in the fitness industry. And I guess to start out, maybe I personally don't think I'm that well informed. Personally, myself, maybe some others haven't looked too much into it at the moment. What do we know right now about the vaccine, Bryan?
Yeah, it's a great question. So obviously, governments around the world are making sure that there's a speedy delivery of the vaccine, but at the same time, making sure that there's certain testing and certain controlled groups to understand the consequences. It is a new technology. This is genetics. It's mRNA. So it's very interesting in what it does. Very different than classic vaccinations that have been done differently, where it gives you, a part of the virus to kind of trick your immune system, where this is actually impacting the body on the cellular level. So it's a very advanced form of that. So it's a new technology, but there, as there are anti-vaxxers out there that have been around a while. And, I saw, in fact, Brent Darden and I did a podcast a couple of weeks back, and the stats, I forget where he got the survey from, but in the US, he said to me in all the podcasts that 61% of gym goers weren't going to use the vaccine. I saw today that firefighters in New York, I think it was like half weren't going to do it. But the good news is, and assuming that our government agencies are doing their jobs, is that the effectiveness of these two recent vaccinations, and more to come, exceed 90%, which is super high. And if you get, just about 50% of the population, a little over 50, maybe 55% of the population, to take it, you're going to reach herd immunity. I mean, you can actually do less than that to probably reach herd immunity at that level. And this is based on McKinsey and companies' research that they published this fall. I think it's September. So, of course, you already know it's going to take 2 doses. But given the stats I've looked at and looking at McKinsey companies' research and looking what we're doing with distribution, I think by the end of Q2, I think by midsummer, we're going to be coming out of this. I think that's a real potential. And so that's good. That's really good. So far, the reports have been that there's not been a lot of adverse effects from the people in the controlled group. So hopefully that information continues. We are very fortunate to have some great scientists in Europe and elsewhere around the world working on this stuff. And so man, if we get that done, there are going to be a lot of blue skies by this time next year, if not earlier. And we'll all be traveling around together, catching back up on the things we missed.
Yeah, I know that we're definitely looking forward to that as well. So one can only work from home for so long before you start to get a little bit stir crazy.
Right.
And I know that a lot of people are looking at the vaccine as a way in order to move forward.
Yeah.
Maybe a follow-up question on that is, what exactly is this vaccine going to mean for businesses? I mean, is the announcement a turning point already? And if so, how should a business take that into account within their planning? Or is there another turning point that we should be looking for?
Yeah, it's great. The McKinsey report I referred to before, they did a survey, and it's a global survey that kind of touched on some of this. Already back in September, the McKinsey survey showed that about half of the people surveyed around the world, in some countries higher than others in their optimism, expected the economy to be very optimistic within 6 months. They expect a surge in demand coming. And so what I think you're going to see is mentally, once you see the distribution of it happening and people starting to take it, I think that's starting hopefully in a few weeks. I think people are going to get very bullish. And I think that when you're looking at a 6-month, or 4-month window, probably a little regionalization around this. Once people start seeing this, I think that from a business perspective, they're going to start prepping and knowing there's light at the end of the tunnel and understanding what that time frame is going to be. And, we don't have a perfect crystal ball, Kalen, but if we start seeing what happening the way I think it's going to happen, come May and June, you're going to, people should be prepped up and ready. I mean, they should be mentally prepared before then, but prepped up and ready for customers, because especially in our business where a lot of people are going to be closed and, there are going to be a lot of people, aching to get out. And once they're starting to build that confidence, I would be prepared. I'd really start thinking about what that means for my fitness business.
Excellent. I know a lot of people are happy to hear when you're talking about the May-June timeframe, because everyone's thinking we're going to be able to have in-person IRSA again. I know a lot of the people listening to these calls attend, including ourselves. But you made a good point there where you're talking about this time frame, about how, give or take that May-June area, people should be ready to go, but it's not a light switch, right? You can't just turn this on overnight and it's going to happen. So, curious to know with your consultancy, et cetera, are organizations already reaching out to you asking for assistance on this topic, just in general? And maybe more so for the people listening here is, how do they start and when should they begin to act to make sure they're getting to this May-June timeline to make sure they're prepared?
Yeah. So first off, I do advise brands on this, but we, as I mentioned before, have 14 operating companies, so we're actually day-to-day involved in that very process. So, whether it's our Vertimax product and company, or if it's our clubs in Thailand, or it's other technology providers that we own, et cetera. We're looking at this every day, thinking about this. I mean, we're a calendar year business, so we're finalizing all our budgets now. So. And we, like a lot of people, we use kind of a conservative model, and then we have kind of a, some guardrails on optimistic and downside. We plan to cover our downside. That's the emphasis I give to clients that talk to us, and what we do in our own companies. And really, for many, sadly, it's a function of liquidity and how long. I mean, for some folks, they've been struggling for a long time. So they're going, all right, I need more money. What is my baseline? They're working with landlords, lenders, other people, trying to give themselves a long enough runway. And that's really pragmatic. And then, and at the same time, they need to make sure that they're not losing their relevancy in the market, that they're doing things to serve members, to be present in the community, to do things so they're top of mind, and even, engaging with clients as they can, depending on their situation. Because if you're in Southern California right now, it's a very marked difference than you are in maybe Southern Alabama. So, it depends on their situation. But I think planning, and just being extremely conservative right now, keeping your eyes open as to what's going on in the local market, looking for opportunities. If they're, depending on your operation, if there are great trainers or operators or other people who have been involved in other facilities, and those may be going out of business, or maintaining a network so that you can even upgrade talent, being in the community, being very active, creating value, building trust, so that when the worm does turn, you're ready to go. And you're right, it's not a light switch, but I think for some organizations, it may be a little bit of a light switch. I mean, you may see, surge in demand of significant proportions over a period of 60 days or less, depending on the market. So I just think it's that balance of being very conservative and, reserve resources, knowing that light at the end of the tunnel is coming, and preparing yourself. Also, spend time evaluating your programming efforts. What do you need to be planning for as far as delivery of service, programming, even pricing. In certain markets, I think pricing power will be a thing where competition was more severe before, where you might be able to take pricing up. And people won't mind if it's a great experience, so anyway, that's a long answer.
Yeah, thank you for that. And I think one of the other things to take into consideration as well is, obviously we can do so much in order to plan from our end as operators. However, we know that there's going to be regulation in place in order to be able to guide us as well as we formulate our plans. What are you thinking is going to be the way that this will be announced? Do you anticipate this will still be something to be determined at the local level, or do you think we're going to see this announced at the federal level this time?
It's hard to say right now. As you know, Ursa, I was just on a call with a number of the board members right before our call. We have a lot in the United States, a lot of active state alliances. We have a lot of European partners, Asian partners, all over the world, and each dealing with a different strata or aspect of governmental regulation. I think in the United States, because of the nature of what the regulation entails, I think many of the aspects will be very difficult to address on a federal level, just because, the governance of certain things is very local. So, and there's variation from place to place, even when within your own state or county, there are variations. You have different codes of things that are related, et cetera. So I think you're going to see, probably with the new administration coming in the United States, probably a little more oversight and attempt at coordination. But I think the regulation will still come down to the state and local level, where the rubber hits the road. And, in the end, hey, we just have to get the vaccine out there, and that'll take care of itself, because once people start seeing the benefit of that, and the virus is, placed at bay, then, those local governments can start reacting accordingly and starting to kind of free up some of the restrictions as they see the benefits of that, therapy working. So, but that's my thoughts on it, Kaylin.
Got you. So obviously we would want the vaccine and the return to normal being yesterday. We know we already missed that, but it is coming. It seems to be inevitable sometime in the near future. I know from basically previous conversations, podcasts I've heard you on, and then also, you speaking at Ursa, et cetera. I know that technology is something you're very passionate and something you really enjoy speaking about. So curious to know, on this return to normal, so to speak, so as people are coming more back into the physical location, tell me about the role of technology and how it stays there or alters its interaction with the member along the way back to normal.
Yeah, well, as we mentioned before, Derek, these seeds were already planted and COVID just accelerated them, and technology was one. And it's a very big conversation. So I think you have to start with the customer, and it's what is convenient for the member, and what do they want, where do they want it, when do they want it, whatever it is. And that speaks to both pure digital delivery, in studio delivery, in club delivery, whatever the delivery mechanism is. But certainly, delivery of technology related fitness services have been growing at significant rates. I think 2 years ago, we're just talking about fitness trackers and apps. 2 years ago, the last credible study I saw is there's 1.2 billion users of pure digital solutions, and that didn't include smartwatches. Now you see, Apple, Amazon, Google's acquisition of Fitbit. The big tech now is, they need to keep their stock price up. And the main realm of market share that they don't have that will drive value for all these big tech firms is health. It is the largest sector of the economy globally that big tech isn't really, tapping into as much as they can. So they have a lot of impetus to continue to innovate. And they have a lot of money to innovate as well. And they have a lot of, initiative to innovate around that, whether it's an Apple Watch or it's a new Halo Amazon solution or whatever it is. And there's a lot more to come there. And at the same time, as digital becomes more and more a component of our everyday lives, we also have the reality that people enjoy that convenience. They're going to expect that convenience, but they also are going to want different experiences that are very human and human centric. So you think about the food industry, which I was in for many years, and the fact that, dining and cuisine wasn't a thing until, the 50s, 60s, 70s, and it's become prolific. And now because you can cook great Italian at home doesn't mean you don't go out to a fantastic Italian restaurant when you want a great experience. The same is true with digital in the realm of music. As I've said before, digital music was sought as the death of the music industry by Sony and others. When after digital became more prolific in music, the number of live concerts attended and the number of albums purchased went up 300% in the first decade of the 21st century. So I think you're going to have some operators in bricks and mortar fitness that probably going to go, I don't want a piece of technology in here. And by the way, it's going to be hot as hell. You're going to sweat. We're going to grind iron. You're going to leave your smartphone at the front. I don't want any interruption. And some of those are probably going to be super successful in the sense that that's a very finite experience. Kind of like people still like going for nostalgia or experience to drive-in movie theaters. There's still 300 of them around the United States alone, and they've been going there more frequently as of late. And then there are going to be other operators that are going to do a great job of deftly integrating this technology aspect with great human interaction. So I think you're going to see a whole strata of different integration of technologies around a business model that people are trying to run. And it really has to serve a purpose. What experience are you trying to really deliver and why? And designing that appropriately. And automating low value tasks that you do very well, like personas in your marketing communication when they go to your website or whatever, many other things. And then when it comes to those, empathy, real connection of groups, real, sense of community, doing that real well, because technology right now can't do those things by itself very well. You can augment it, you can heighten it, you can integrate it. So I think just technology is going to be kind of a gateway drug that enables more people to enjoy fitness, just like music. I would have never known anything about West African reggae if I didn't have access to 10 million songs on my phone. So that meant I would have never have gone probably to see a live concert of a certain artist that I would never have heard. So, I think it's going to be the same with all industries and ours in particular. So we're just getting started in that realm. I think tech's going to drive a lot of consumption of fitness and health service.
Yeah, excellent point. And I could say personally, from my perspective, there's certain parts of technology that I didn't think that I would actually use in real life situations. So, for example, I personally wouldn't have been a fan of going to a restaurant, scanning a QR code on a table so that this way that I can upload the menu. For
Right.
me, that I like QR code technology, but that was just an experience that I never saw necessary. And COVID, I think, put everybody in a position where we have to do things like that. And so I do believe that maybe that has changed my mind now. And even in a return to normalcy, I personally I'd be okay with continuing along that path because it didn't feel as bad as I thought it was.
Right.
And kind of with that kind of being an example, is there a direction that you think the consumer is headed in this as well? I mean, we talked a little bit about how the business should be taking into consideration their business models, but is there any consumer trends that you see, or ones that maybe that weren't an opportunity before but are an opportunity now as a result of COVID?
Yeah, so I think those things were already in place. I think COVID just accelerated them. Obviously, high degrees of personalization would cover across the gambit of all delivery systems where you're not marketing or serving a one size fits all unless you're a very utility based provider, a budget model, where you're basically running on treadmills and you don't have much, we're, using technology tools, and that was existing before COVID. I think it's going to be more relevant. I think that, as far as a business model goes, I think that, the two big drivers right now, in the United States and in Western Europe, um, boomers and a portion of Gen X, they control 12% of the net. I mean, 12 times the net worth as the millennials do. Their age is getting, in the 60s, 50s, 60s, and older. And I think that they have the money to spend on service. I think health preservation is their number one motivator. And I think that technology enabling a better integration of people managing chronic illness or prevention of chronic illness through lifestyle, and that is, integrating nutrition, even, mindfulness, travel, all these things into lifestyle type solutions. And you see Equinox has done this, they were moving this way. I think that's a big area, an arena of growth in the wellness industry for that cohort of folks. That is just a mammoth size opportunity. I think, that was already there. I think kind of COVID probably accelerates that a little bit. And I think, integrating that ultimately with concierge medicine and really providing hyper personalization around people at that age, because, people before used to think of those as old timers, and more, been a downshift in age perception where people in their 60s now think of themselves as in their mid to late 30s. So they don't see themselves as old. They have plenty of money. So I think that's a big arena of service that is going to be gigantic in the coming decade. So I think that's one example of opportunity.
Excellent. And I guess trying to kind of loosely tie in a few different categories or themes that we've talked about earlier, bringing the vaccine into it, bringing into consideration short-term industry direction, et cetera. One thing I'm curious to know is when we do get to that point where the vaccine is administered, is starting to be used by the public. Obviously, it doesn't happen overnight also where everyone's going to get the vaccine. And then there's also people who want the vaccine. Others, you had mentioned, are adamantly opposed to it. For the client experience and the member experience, are there going to need to be two different processes? And what I mean by that is, someone who has the vaccine, if they can show that they've taken it, are they privy to some kind of different experience or protocols with masks, et cetera? What are your kind of views on that?
Yeah, I just read an article about this when it comes to some countries in Europe, saying if you get a doctor showing that you had the antibody, that they were letting you travel. The World Health Organization, there were some people with that really debating the pros and cons. Yeah, that's going to be tough. I mean, I assume that we'll reach a gray area of time where, there'll be this lag between really having things fixed the way they need to be and, not getting there yet. That'll be curious. I don't know. I think, I'm sure some operators, I mean, they're screening, it's done in a number of facilities around the world, temperature check, other things like that are being done and were being done. In this case, you're going to need some third-party verification of some type, obviously. And it wouldn't surprise me if you'd see governmental agencies consider that, kind of gatekeeping that. If you're a private enterprise doing it without some third-party reliable source of confirmation, you might create some trouble for yourself. And this is also part of, in the United States, a part of the federal legislation that's being discussed right now when it comes to liability of businesses when it comes to COVID, because that's another thing. So if you start representing, well, we're going to let these members in because they proved, and it turns out that wasn't a reliable source of proof, you could get in trouble with other members who, later catch it and they relied on you. So it's going to be curious. I don't know if I have a definitive answer for that, but I'm sure someone smarter than us is going to come up with a solution.
Well, this is a follow-up question. I know you kind of didn't have a specific answer there, but curious in this aspect, it's because something me and Kaylin were talking about earlier is, let's say even, me and Kaylin are both in the gym. Kaylin has taken the vaccine, etc. He's not wearing a mask, etc. Maybe he's followed through with some of these processes, etc. But me, just as another gym member who knows nothing about Kaylin, is just seeing someone walking around the floor, no mask, not wiping down his machine, and that could even if it has grounds, is obviously going to cause some kind of level of stress or fear from, someone like myself seeing it from a different perspective.
That's right. And in fact, the World Health Organization, the quote, and forgive me, I've read that this morning, alluded to this very thing where they're saying, well, you may be indirectly communicating to people not to get vaccinated or not take other precautions because of seeing other people and they figure, well, or even people rushing to get it as soon as they can and catch the disease so that they can become, exempt from any restrictions. So it is all kind of messy scenarios like the one you just described. So it'd be tough.
Yeah, super interesting. Whoever comes up to the best answer to that, that'll definitely help, because I can see a lot of confusion with that. Nobody's got the answer, huh? And but I'm curious as well. Based off of what you see happening in the industry, and if you were in a position to where you could either reconsider a business model of a gym, or you're somebody who wants to come into the space, has a passion for fitness and wants to be able to go the entrepreneurial route. What type of business would you create in order to be able to potentially thrive within this time?
I really like the idea of servicing the active aging market a great deal. Mm-hmm. I like that a lot. But listen, there's plenty of opportunity. I mean, great. The budget models will continue to be a huge share of the market. With Planet in the United States being a gigantic player, they're already at a very high level of recurring revenue, given their price point and scale. They have a huge advantage in what they're going to be able to do around digital and customer service. Because when you get 2,000, 3,000, 4,000 locations serving, now I think 14 million people, probably in the next 2 years, probably 20 million. It's a sizable, population of people to do things with. So I think they're going to be in a great, situation, just like McFit or other operators in Europe and elsewhere. But for me, if I was starting out from scratch, I think, highly personal services that have a component of digital and physical in it, with great personnel providing health and fitness services, and making people pay a high dollar for it. I mean, I would stay out of the middle, like most people have been advising over the years, because of the bifurcation of the market. And I would go that way. I think studios are going to have some challenges for a period of time, in the sense of group fitness space. A lot of those facilities are going to be closed. So there'll be opportunities there coming back on the rebound, I think, no doubt. I think there are going to be opportunities all around. But personally, if it was me, I'd be at the high end of the market.
Thanks, Bryan.
Yeah,
Perfect.
And
Go ahead, Derek.
sorry,
Sorry.
one thing, Kaylin, I've asked this in previous conversations with some others, and I'm curious to know because not sure if you know this, Bryan, but you've definitely demonstrated that you have a fair share of resources. You're reading different content on a on a rather frequent basis. Also, you're talking about conversations with different organizations. For a lot of our listeners here, obviously something like this webinar podcast is something very beneficial for them because they're learning about these trends. But do you see any kind of resources out there as like, must reads or must kind of interact with, to get on top of this stuff, just to add to their information?
Well, I just got Scott Galloway's book. It's escaping me right now on post-pandemic. That just came out. And I've just started reading it. So shout out to Professor Galloway. Let me get the name of the title. I would really get that if you could. That's a very very good book. I'm gonna pull it up right now. It's called Post Corona. So it's a very interesting trend book. Of course, URSA puts out at ihrsa.org a lot of great free information and content, constantly updating it. You can follow them on any of the major platforms. They're a great resource. I really like the Galloway book, though. I really like Harari's 21 Lessons for the 21st Century. I'd recommend that. And then I also recommend Rita McGrath's Seeing Around Corners, a great strategy book. Very thoughtful, one of the foremost experts on strategy. Professor Galloway, teaches at NYU, and Rita teaches at Columbia. So they're both New York based, but Rita McGrath's a great strategist, and Seeing Around Corners is a very real world way to look at your business today with what's coming and the changes that have been going on. So, and then Harari, of course, the author of Sapiens and Homo Deus, 21 Lessons for the 21st Century is a good reflective book. So I think there's some must. You can follow these folks on Twitter and most of those networks. Scott has a great podcast. Rita does as well. And Harari does too. So you don't have to buy the books. I think you can listen to Scott's section 4. I think it's his podcast. And he actually was reading excerpts on the recent podcast he's done. So a lot of this stuff you can get for free on YouTube, listen to their podcast, so you don't have to spend money. But if anybody wants to learn more about that, they're more than happy to reach out to me directly. I'm happy to help.
Perfect. Well, thank you so much, Bryan, for taking the time in order to join us today. I can say that from my end, it's been super insightful, and it's always a pleasure in order to be able to speak to you. I'm sure we've got a lot of joy and delight from this as well from the audience members who are participating as well. I want to give a thank you to you guys as well for taking the time to join us for another Lunch and Learn, and we'll see you guys on the next one.
Yeah, thanks everybody. Great to see you all.